Eating disorders have become one of the banes of modern life. Once almost unheard of, they're now disturbingly common, especially among young Australians. Hundreds of thousands of people are afflicted, almost 25,000 of them by the most well-known of those disorders, anorexia nervosa. But there's a dire lack of treatment services for the conditions, and the families of sufferers say lives are being put at risk. Louise Milligan reports.
In a darkened room, in a small house with the blinds drawn, a young musician is fighting for her life.
Liver damage, pancreatitis, bowel obstructions, heart complications, just general malnourishment. A lot of the time I actually don't believe that this is really real.
Tara Powell has anorexia nervosa. She's living at home, fed via a nasal gastric tube. And in her own words, on her bad days, she's just waiting to die.
Some days I really want to get better. I really want to beat this. But there are a lot of days where I just would rather be dead.
Tara was diagnosed at 13 after her school realised she just hadn't been eating for some time. She was rushed to hospital. Since then, the 24-year-old from the New South Wales Illawarra region has been admitted to hospital about 30 times. But things became particularly bad 3 years ago.
I was just on this downward spiral of not eating and exercising, and I ended up in my local hospital emergency department, and I was so terribly unwell that they didn't know what to do with me, and so they called every hospital in the state and spent hours trying to find a bed.
Tara Powell didn't have top-level private health cover, so her parents had to pay up front.
How much did it cost to be there?
So it was $3.5 grand per week. Yeah, which is a lot.
Her father, Ken Powell, has terminal cancer and couldn't afford Tara's hospital bills. But there are only 5 public hospital beds for eating disorders in New South Wales. After desperate lobbying, Ken Powell managed to secure one at Sydney's RPA Public Hospital.
So in order to not go broke and sell the house and assets, we decided that there was a bed became available there, so we moved to there.
It was a decision Ken Powell bitterly regrets. RPA's eating disorder beds are in the hospital's locked, unisex psychiatric ward.
I took Tara there on the first day and I was a little bit shocked. And I'm thinking, I'm not so sure about this place. And each visit thereafter, we saw that Tara wasn't getting better. There was no program, and it was quite apparent that there was nobody there who knew how to treat a patient with an eating disorder.
I thought that living with anorexia was a nightmare, but living with anorexia while living in RPA was just unbelievable, yeah.
Somehow, Tara Powell says she managed to lose weight. She says no one supervised her eating and she stayed in her room, terrified of the male psychiatric patients who roamed the ward.
And a lot of the time, I just did whatever the anorexia told me to do, so...
And what was that?
I'd spend hours exercising, to the point where I had sores all down my spine, all on my bottom from just hours and hours of exercising.
It's a very difficult illness, and it's really tough to treat. And I think there's a lot of challenges in terms of how things are managed in terms of the renutrition. It is really difficult. We have got specialist services here at RPA, and we've got a range of them. From the inpatient beds, we have a comprehensive day patient program, and we've got also outpatient services. So we do aim to, provide specialist services and meet people as per their clinical need here at RPA.
Ken Powell says he found Tara lying on her bed at RPA in a semi-conscious state. He felt he had to get her into a private hospital. By now he'd got top-level health cover, but it would take 6 months to come into effect. A friend offered him a no-interest personal loan.
But to pay back that personal loan, you've had to take a second mortgage on your house?
Correct.
A report by Deloitte Access Economics for the Butterfly Foundation found there are almost 1 million Australians with eating disorders, 25,000 with anorexia. It estimates more than 1,800 people died from complications associated with eating disorders in 2012. Around Australia, patients complain that the number of public hospital eating disorder beds is woefully inadequate. So there are 5 in New South Wales, 6 in South Australia, 9 in Queensland, 14 in Victoria, and none at all in Western Australia, Tasmania or the Northern Territory. The New South Wales government has announced it will increase its beds from 5 to 9. Ella Graham has been in one of those beds. She's in recovery from her eating disorder, although it's a struggle. Ms Graham had to come from Sydney to Geelong in Victoria for treatment in a private psychiatric clinic.
My name had been on the waiting list around the country because I'd been in and out of emergency departments. So Geelong was the first bed that came available.
Ella Graham spends every last cent of her disability pension on healthcare.
I honestly believe that if my treatment was left up to the public health system, that I'd be dead.
Cassie, who doesn't want to use her surname, lives in Perth. She's just come out of a second stay at Fremantle Hospital after her weight plummeted to under 35 kilograms. There are no public eating disorder beds in WA, so she was admitted to the locked psychiatric ward. These are pictures of injuries Cassie says she suffered after she was restrained by hospital staff.
I think it's just appalling that the only options in the public health system is a general psychiatric ward where they don't address the psychological issues related to an eating disorder, and they don't have specific programs.
We have a horrific situation in Australia with a whole cluster of people who can't access treatment. On one hand, private hospitals are limited in what they can offer, and therefore it means that people have a very low body weight, or if they have more problems than just an eating disorder, they won't be admitted into a private hospital. On the other hand, the public system will only accept the very, very sickest simply because they're so poorly resourced.
As for Tara Powell, one of the private hospitals she attended has closed its eating disorder program. Her private health provider sent a letter to her father this week announcing it had ended his arrangement with a second, meaning yet again her options are limited.
We need programs in hospitals and more training as soon as possible, because people do die and are dying from an illness it's really treatable.
And anyone seeking help regarding an eating disorder can call the Butterfly Foundation on 1800 334673. You can also join an online conversation about anorexia and its treatment. Just go to our Facebook page at facebook.com/ABC730.